This handout discusses the prognosis, an essential tool in your care. Knowing its power and its limits is key to using it optimally. I was a young mom with 3 children under 6 when diagnosed with cancer. The textbooks all stated that the median life expectancy was 7 years. Fortunately, I knew that my prognosis did not predict how I would do because it was based on groups of past patients and not on clones of me. Somebody ends up on the right side of the survival curve. Why not me? For all we knew, there might be something about me or about my tumor that would help me land on the good side of the statistics. In my case, we were also charting new territory. The aggressive regimen of chemo I was about to receive was new, too new for any long-term data. That chemotherapy did not cure my cancer, but it did keep me alive to benefit from subsequent therapies that came along, treatments that succeeded in putting my cancer into a lasting remission, treatments that were not options when I was first diagnosed. 30 years later, I am living testimony to the idea that a prognosis is not a prediction. It's only an educated estimate. As researchers discover and develop more effective treatments, the prognosis improves, and the textbooks are rewritten. In the handout, you'll read about how to use your prognosis to make wise decisions, not only about cancer treatment, but also about work and home. You'll find insights and practical tips on minimizing anxiety triggered by a worrisome prognosis, and on finding hope. I know it's easier said than done, especially if you can't get a prognosis out of your mind. After my second recurrence, I faced a worrisome prognosis. My approach was to prepare for the worst, for the likely outcome, while hoping for the best, and that worked well for me. Taking care of all the what-ifs brought me relief and, unexpectedly, freed up energies that helped me feel more hopeful. Meanwhile, my worrisome prognosis motivated me to focus on making the most of each day, a wonderful way to live with or without cancer. After a cancer diagnosis, your prognosis plays a key role in making wise decisions. Use this handout to help you think about your prognosis in ways that help you make your life the best it can be.
Welcome to Oncology Patient Handouts and Resources, powered by Oncology Times and the Nurse Practitioner. Here you'll find helpful, hopeful handouts by Dr. Wendy Harpham. Since 2005, Dr. Harpham has been writing our award-winning column, View from the Other Side of the Stethoscope. Her perspective on illness and healing has been shaped by her experiences as a doctor of internal medicine and as a cancer patient who received many courses of treatment. Our hope is that this resource helps you obtain the best care you can and live as fully as possible